In our youth, the days when our energy level is low or we feel emotionally worn out are few and far between. But as we age, particularly for women, the zest for life can begin to diminish. The culprit? A lack of hormones that used to be in abundant supply.
What happens to women's hormones as they age is that, one, they're getting closer to menopause. So therefore, they may not be ovulating every month, and they're putting out less of the most important hormones, which are testosterone and estrogen. It could be as early as the 30s, mid-30s, but more so when they're 40s, and especially when they hit menopause at 50.
These changes are occurring in millions of women across the country, many of whom are finding daily life challenging as a result. Symptoms can vary, but some of the most common complaints include fatigue, anxiety, irritability, moodiness, and low libido.
In my early 50s, I was feeling very tired. I had lack of patience. I was going through an emotional drain. My sex drive was decreasing. And overall, I was just feeling gloomy. It affected my marriage. It affected the relationships with my friends because I didn't have the patience, I didn't have the energy, I didn't have the strength to deal with everything that was coming at me. And it was an overload on me.
In recent years, natural hormone replacement therapy has become a popular choice for women who want to restore the functions and feelings that have been depleted over time. More specifically, and perhaps most exciting, is the availability of bioidentical hormones, meaning they are an exact chemical match to what the body produces naturally. From a safety perspective, bioidentical hormones are imperative to keep women healthy in addition to feeling better.
The Women's Health Initiative study was a large study. They looked at women all across the country, giving them 2 hormones, both of which were synthetic. And it showed that there was an increased risk of breast cancer, heart attacks, and strokes. There are a lot of smaller studies that have been done across this country and in Europe that shows a decrease in breast cancer when we give women natural hormones. The hormones are derived from plant steroids. So the estrogen comes from yams, the testosterone comes from soy. And they're made in a laboratory, and they're able to make them identical molecule by molecule as what we are putting out in our bodies. Our body recognizes it and utilizes it more efficiently. Where the synthetic hormones, they have to be modified in our gut, by our liver, and sometimes these hormones are just totally foreign to us and they don't offer us the protection of the natural hormones.
Donna Mile decided to undergo hormone replacement therapy and began to feel better almost immediately.
I just felt overall wonderful, energetic, sound mind, sound thinking. I had not experienced that in years.
We were back connecting emotionally, physically, spiritually. We were connecting on every level. It was almost as though we were tuned into each other the way we were when we were first married.
The issues that come with getting older is something many women don't want to face. But thanks to advances in hormone replacement therapy, women like Donna can look forward to aging gracefully and more happily.
The reason I'm so passionate about bioidentical hormone replacement is that over my 26 years in practice, I've seen many women with the complaints of no energy, lack of enthusiasm, no sex drive, and all of these can be remedied by replacing their hormones and balancing their hormones. My experience, personally, I use it. I've seen a personal difference of increased clarity, ability to multitask, memory has improved, more energy to do more things without being tired at the end of the day. Multiple things I've seen.
Are you a woman aged 40 to 65 who is experiencing one or more of these symptoms? If so, you may be a candidate for hormonal replacement therapy. To find out, an appointment with Dr. Marsha Gorens will help determine your healthcare needs.
Dosage is determined by a couple of factors. We look at her blood work, her symptoms that she's complained of, and her size. We also will see her at the end of that period and check her blood work in 5 weeks to compare it to the before and the after, and we can modify her dosage at that point also.
Hormone replacement can be administered in one of 3 ways. Delivery via pellets is considered the gold standard method by many doctors because of the way it enables hormones to enter the bloodstream.
Once the pellets are placed into the body, they have to get released into the bloodstream. And the rate of their release depends on the activity of the patient. So while at sleep, they're released slower. If you were running a marathon, your body's going to pull in more hormone. So it's almost like we replaced an ovary.
Dr. Gorens helped me to feel comfortable about it because I'm a breast cancer survivor of 5 years. And I was concerned about my hormones and the estrogen levels being affected by the treatment. But through research and her looking into it, she made me feel very comfortable about receiving it. And I've felt very good about it because she monitors all of my levels.
Board certified in obstetrics and gynecology, Dr. Gorens has over 25 years of experience and has quickly become a leader in bioidentical hormone replacement therapy in the greater Chicago area.
I'm delighted to be one of the ones that's promoting this because of what it does for women. When I see the patients before and after, it's like I have an opportunity to give them their life back. They feel so much better.
She is a ball of fire. She's always on the go. It's almost like she's back in her 20s. I have to keep up with her. I'm excited about this. I'm thankful for this, and I'm glad it's here.
If you or someone you know would like to know more about what bioidentical hormone replacement can do, schedule an appointment with Dr. Gorens today. For more information, log on to drgorens.com or call the number on your screen.